Ladies and gentlemen, welcome to the 11th Annual Student Innovator of the Year competition. My name is Joe Holt and I have the honor of hosting this event for the second year in a row. Now, before we begin, we would like to have an opening prayer from our student co-director, Nate Coleman.
Our dear, kind, and gracious Heavenly Father, we thank Thee for this opportunity that we have to compete in this great competition. We ask Thee to please bless all of our competitors, that they can present their projects well and have the inspiration they need to continue to be successful. We thank Thee for these opportunities, and we say these things in the name of Thy Son, Jesus Christ. Amen.
Thank you, Nate. For 11 years, the Student Innovator of the Year has helped students turn ideas into reality through funding, workshops, and some healthy competition. This year's SIOY participants will compete for over $50,000 in prize money. Last week, 50 teams competed in front of 60 judges at the SIOY showcase. Judges selected the top 7 teams to advance to the final competition. SIOY competitors are judged on 3 categories: innovation, engineering, and impact. Today, all 7 finalists will walk away with $4,000 each, but only one will be crowned the 2021 Student Innovator of the Year and win a grand total of $12,000. Our judges will also award a runner-up a total of $10,000 and a third-place runner a total of $8,000. And you, the audience, will vote for the finals favorite, who will receive an additional $2,000. First, let's meet our judges. Judge number 1 is Tom Ingersoll. Tom Ingersoll earned a bachelor's in mechanical engineering and a master's in engineering management from BYU and is a commercial aerospace entrepreneur in the space and communications industry. He started his career at McDonnell Douglas Corporation, where he led advanced technology projects in satellite and rocket systems. Tom was co-founder and CEO of Universal Space Network, a leading provider of global ground station services to the satellite industry. Most recently, he was CEO of Skybox Imaging, leading the company from concept development through the build and launch of 2 high-resolution imaging satellites. These satellites were the first commercial systems capable of capturing high-definition, full-motion video from space. Tom led the sale of the company to Google, who made an unsolicited bid after examining the quality of the imagery and video. Tom has extensive experience raising venture capital for early-stage commercial space companies. Thank you, Tom, for being here. Up next, our second judge is Chris Musso, who is the former president of Polaris Industries Off-Road, leading a $3.5 billion business that designs and sells several 100,000 machines every year. Before joining Polaris, Chris spent 13 years at McKinsey & Company, where he was senior partner and leader of the company's Americas Project Development Group. He is the founding partner of McKinsey's Denver office and built it into one of their fastest growing locations. Prior to his time at McKinsey, he spent 5 years leading an engineering and modeling consultancy. Musso holds a doctorate in engineering systems from the Massachusetts Institute of Technology, along with master's degrees in materials science, business administration, and technology policy, also from MIT. He earned his bachelor's degree in manufacturing from BYU, a program he supports by serving on its advisory board, sponsoring a capstone project, and mentoring students. Thank you, Chris. Our third judge is Craig Paulin. Craig Paulin received his bachelor's in mechanical engineering at BYU and his MBA from Yale University. He joined Pacific Sintered Metals, PSM, as a marketing manager, later became general manager, and then went on to purchase the company and become president. He built PSM Industries into a world leader in design and engineering solutions for powdered metal and metal injection molding components, primarily for the automotive, power tool, and sporting goods industries. Craig has served as president of a $3 billion international trade organization, the Yale School of Management Alumni Association, and judged a number of new venture awards programs for university students. He has served on the advisory board for the Yale School of Management, the BYU ACET Council, and now the BYU Engineering Executive Council. Thank you, Craig. Our fourth judge is Ryan Woodley. Ryan is a proud graduate of the electrical engineering program at BYU. He has worked as a strategy consultant, venture capital investor, and business executive. Ryan is currently an investor and board member of several privately held technology companies. His most recent operating role was as the CEO of Progressive Leasing on the stock exchange, that's PRG, which grew from approximately $220 million to $2.5 billion in revenue during his tenure. Prior to Progressive, Ryan was the first institutional investor and later COO and CFO of DigiCert Incorporated. During his tenure, the company roughly tripled in size and was successfully sold to a private equity firm. Prior to DigiCert, Ryan was a principal of Polaris Partners, a $4 billion venture capital firm based in Boston, where he focused on technology investments. Thank you, Ryan. Thank you all of our judges for being here. Facebook Live viewers, we need you to get ready. We have some amazing prizes to give away tonight, and before each team presents, I will ask a quiz question about the upcoming presentation. Listen for the answer and comment as soon as you hear it. The winner will be the first person to correctly comment the answer, and some giveaways will have multiple winners. Folks, it's time to meet our very first contestant. That means our first quiz question is ready. So this is to win a fuse reel or a drawing tablet. Now the quiz question that you have to answer correctly and quickly is this. What % of genetic diseases lack a treatment today? Listen for the answer and comment as quickly as you can as you're listening during this presentation. Folks, give it up for our first contestant, Geneial.
Thanks so much for having us here today. And welcome to our presentation about Geneial, the privacy-preserving genetic data marketplace. Please take a moment to look at these faces. These are some of the people who suffer from rare disease. There's a staggering 400 million people in the world today who suffer from rare diseases. And half of these people have absolutely no support group for their condition. I am one of these faces, but I'm one of the lucky ones. Why am I lucky? Because I'm part of the only 5% of diseases that have a treatment for their condition. Staggering 95% of treatments of rare diseases do not have treatments for their conditions. And why is this? Primarily, fragmentation in genetics data and access to diverse kinds of genetic data for these diverse patients and diverse diseases. This all leads to a very high demand and need today for genetic data to accelerate treatment options. What we do at Geneial is facilitate the connection between data owners and data buyers. We do this in a way that preserves privacy and control of consent for patients. This allows rare disease communities, hospital systems, sequencing centers, and diagnostic labs to search for the data that they need to accelerate treatments for orphan drugs. The buyers, academic researchers, diagnostic labs, pharmaceuticals, they benefit from being able to search for the exact kind of data they need. What makes us special at Geneial? What's so innovative about what we do? We use an innovative technology called homomorphic encryption, which allows us to do processing on encrypted data without ever exposing the contents of that data. That has extremely great potential in genetics, health, finance, and many other industries. We also use standardized pipelines and are cloud-based to make data access easy and affordable. Our business model hinges on 3 pillars. First, we data searchers subscribe to our business and our platform to be able to find the data they need. We broker the transactions between data owners and data buyers and give most of those proceeds to the patients and to the rare disease communities. We also engage in profit sharing and subject any treatments that are developed using our platform to a small percentage of revenue sharing. The market potential for this is massive. We directly address the orphan drug market, which is growing at a rate of 8% and is currently valued at approximately $169 billion. There are also massive opportunities as a facilitator in the contract research organization market. So, in terms of engineering, how do we do this? Well, we've iterated through many different architectures that maximize the benefits of our platform for all. First, queries are received from users. We find which possible genetic variants match that criteria, and if any of our data vendors have that data. That information is sent back to the querier where they decide to purchase the data or not. And we facilitate the transaction without ever seeing the contents of the underlying data. Finally, the results are returned to the user. And this is what a complete system looks like. I am Chris Hansen. I suffer from a genetic disease. I have a background in computer engineering and MBA. My partner has a PhD in computational genetics. And our advisor is the founder of the Human Genome Sequencing Center and top funded NIH researcher in the US. Thank you, and we'll take questions.
All right, thank you, Chris. Your time is up. Now let's go ahead and talk to our judges where they can ask you some questions.
Wonderful.
Thank you, Chris, for that great overview of your business. Just curious what the current solution to this problem is today. How does it work in the absence of this exchange?
Yeah, so I have a couple slides that can go over that. Here we see that we're actually, first of all, we're the only biobank aggregator. So we're not like most companies that go and try to build the biggest biobank that there is right now today. Right now, there's like a massive land grab going on for data. And frankly, there's a lot of self-interest. Our motivation is to open up the market, to align the incentives for all, so that everyone can benefit from the data. So that's one way we differentiate ourselves in our business model, is through aggregation of data.
Tell us how much market traction you currently have. How many users do you have, and how have you been able to demonstrate the value of your service?
Yeah, so going back to our advisor slide, we have a signed letter of intent with the Human Genome Sequencing Center, who is our alpha customer and actively engaged in helping us build the initial prototypes of our search engine and marketplace. Our initial strategy as a beachhead is to enter at the low side of the market in universities and academic research, gradually make our way up.
Thank you.
Continue.
How does data for the rare genetic disorders you're discussing compare to just the general noise in the population? I mean, how do you differentiate? Are you seeking, and in what way do you separate that data?
So let's see if let's go back to this slide. Genetic data is, frankly, a bit more complicated than regular health data. There's some other companies that are going after, health data generally, but few that lack expertise in genetics, which has very specialized pipelines and processing algorithms. I hope that answered your question.
Can you talk to us a little bit more about the revenue model? How do you get paid?
Yeah. So first, we provide value-add services for customers that are looking for data. We allow them to search based on phenotypes or symptoms of a disease they might not even have to know anything about genetics. And we can connect that information to the genetic data that's relevant for those conditions. So we charge a subscription that's different depending on the customer. We also broker the transaction for data that's relevant that they want to purchase. And there's a huge market for these transactions and a lot of publicly available transaction history, but no services that are doing this per se. And finally, the revenue sharing will allow us to provide such a great benefit for the patients. We'll be able to do revenue sharing because we're providing this service that doesn't exist, and it's patented too, so we have barriers to entry established.
So, Chris, would you imagine that somebody would do all three? Like they'd subscribe to be able to get into the database and into the system?
Yeah, in order to do two, they have to do one. So
and
one
in
will
order
help
to
them
do
find
three,
the
they
data.
have to do one and two.
So ultimately, they'll end up doing all three.
And like subscription, how much would a subscription cost?
Pharmaceuticals, we estimate about $80 million in revenue from them, which would be our top. Academic researchers about $5 million, and in the middle, diagnostic labs about 20.
All right, that is our time. Thank you so much, Chris. Thank you for joining us with Geneial. All right, that is a wonderful project and such a cool idea that is so very needed in society today. And it is one of many that we are going to see tonight. Up next, it is time for our giveaway. For those of you who submitted the answers to the quiz question I asked before the presentation, a little bit of background on the giveaway that we're doing right now. It is for the Fuse Reel. Now, Fuse Reel started at BYU and they competed in the SIOY in 2017. They competed and went on to raise $300,000 on Kickstarter that same year. Since then, they've launched 10 successful products for hundreds of thousands of customers around the world. We want to give a special thanks to this wonderful donation from the founders of Fuse Reel. Now to announce the winners of the 3 Fuse Reels. The winners are, listen up, Amanda Bowers Everson, that's 3 names, 1 person, Matthew Cable, and Cammie Buckley. Congratulations on winning your Fuse Reels. We have one more giveaway for this question. The 4th person to answer correctly, I believe. That giveaway is for a drawing tablet. And the winner of the drawing tablet for this quiz question is Adam J. Neal. Congratulations, Adam. Go ahead and you will get in touch to receive your prize. Folks, it's time for our second presentation, which means it's time for another quiz question to win some bone-conducting headphones. Now, the question that you have to answer correctly before anyone else in order to win this prize is, whose best friend is Skapa? Ladies and gentlemen, please give a warm welcome to our next contestant, Skapa.
Hi, we're Skapa, autism's best friend. This is what a typical night looks like for our friend Rachel and her daughter Lauren, who has autism. Because of her autism, she struggles to fall asleep and stay asleep every night. Rachel tells us that she usually wakes up 1 or 2 times throughout the night and needs extra help getting back to sleep. Having a consistent nightly routine can have a huge impact on their sleep quality, but can often feel impossible after a long day's work and when even the smallest thing can set off the whole night, like when Lauren's favorite pajamas aren't ready to be worn. Caretakers of neurodiverse children, including those with autism and ADHD, struggle to support their children's daily routines despite everything they give, often leading to lack of sleep, poor school performance, and other challenges.
Many of you know that Rachel definitely isn't the only parent going through this deep pain. There are about 1.4 million children with ASD in the United States alone, presenting a $412 million market that is notoriously underserved in the technological space. This forces caregivers and parents to resort to their own expensive or manual alternatives to solve this problem. That's why we created Skapa, an interactive device and app that helps families set and follow daily and consistent routines. Let me tell you a little bit about how it works. So what the parent or caretaker will do is download the app, create an account, and then see this parent interface. In this parent interface, they can create custom routines, tasks, and rewards for their child, along with icons, timers, and colors of their choice. After that, Skapa will automatically send the routines and rewards to the child's device, and the device will show them this interface that will remind them when to start their routine and walk them through each task using visual cues. After completing the task, they will receive coins that they then can use to redeem the custom rewards, such as ice cream after dinner or extra screen time. This creates needed motivation for consistency.
As we've been developing Skapa, we've worked closely with the autism community, interviewing over 50 families. 80% of them reported similar stories to that of Rachel and Lauren's. When we presented the initial idea for Skapa, parents kept asking, when can I use this? We received a 7.8 out of 10 wow factor score. As of today, 150 people are using Skapa, with an average session engagement time of 7 minutes. That's over 70 families using Skapa for happier days and better night's sleep. We're also prototyping the use of Skapa in local school districts in their special needs departments. To prototype the app, we have gone through numerous iterations of the device, even pairing it with different sensors like a pulse oximeter. We've done user testing remotely over Zoom. We've launched a beta version of the app on iOS test flight, and today the app is available on the Apple and Google Play stores. Using React Native, we're able to deploy to iPhone, iPad, and Android from a single code base.
In addition to an app, we recognize that a lot of children don't have their own device. So back in March of 2020, we decided to create our own standalone device that was both affordable and interactive and fun for the children. We went through over 40 iterations of prototypes over a 10-month span with multiple ad campaigns and online website user testing to figure out exactly what our customers wanted until we finally nailed a desirable product. Our product is a sleek, multicolored touchscreen device, and kids absolutely love it. It features 2 silicone bumpered sides for durability and has a stand-up or sit-down mode depending on the environment that the kid is in through their routine. As of right now, everyone we have talked to said that they prefer our device over our competitor's device and are willing to pay over $100 for our device. In addition, our device is fully functional and we're ready to give it to who needs it. After using Skapa for a month and a half, Rachel and Lauren are excited. Lauren is getting better sleep and is excited to earn her next stuffed animal, and Rachel is finally getting what she's longed for after years, a good night's rest. We are Skapa, autism's best friend. Thank you.
All right, thank you, Skapa. It's time to turn to our judges for question and answers.
In the 40 iterations on the product that you went through, which is very impressive, I'm just curious what some of the big feature changes or enhancements you made based on user feedback.
Yeah, so some of the big enhancements was we started out with a smaller screen. Started out with that and then decided to go with a bigger screen. They wanted a touch screen. Our customers wanted a touch screen. They wanted something with a good UI, and so we put that in there. They also wanted something durable, so we added silicone molded edges on the sides that kids could throw or drop or chew on, and it was also textured to allow autistic kids to receive kind of a stimulation that they also really wanted.
Provide a little bit more information on your business model. I know you're talking about selling the device. Is there a service fee, or how do you plan to monetize your system?
Yeah, we plan on selling the physical device as well as offering multiple tiers for the application. So the physical device will of course be a one-time sale, which could also be paired with that kind of subscription for the app. We're also looking at a different tier that, for example, schools would be able to use.
How did you pick your 150 current users? Is this a diverse enough group to really be testing this out?
Definitely. We've been partnering closely with the families that we're doing through user testing. You know, the first families that we found out about were family friends, people that we had met through school, eventually through local school districts. I taught for a year at American Fork High School, so we're able to work with local school districts in that manner. And as we've been talking about it and just sharing it with people, even families whose children are not neurodiverse have been wanting to use the application. I even have parents who use it, for example, to do their nightly yoga. It's been really amazing to see the wide variety of applications that people are coming up for it.
Yeah, that was my wonder. Why focused on autism? Isn't the market a lot bigger if you just...
It definitely is. Our intention is to really nail the interaction that we have with the autism community, make it as amazing as possible for them, because if it can work for a community whose needs are greater, then when we broaden up kind of our outreach, we expect it to work, you know, amazingly for all children.
How far along is your software development? Do you feel like after 40 iterations you're there, you're ready to hit the market, and if so, how do you intend to hit the market?
The device is fully functional, and the app's launched on both app stores, so Google Play and Apple App Store. So those 170, 150 users are using the app currently from the app stores. So it's fully developed. It's just about getting feedback and adding features based on customer feedback from here on out.
There are a couple key features that we want to include before we monetize it. For example, one really highly requested feature is for parents to be able to upload their own images, which the children will be able to recognize a lot more easily than kind of the standard icons that we already include. So a little bit more development, and then we plan to roll out those subscription plans.
All right, go ahead, Craig. Just so you know, we have about 20 seconds remaining.
Yeah, absolutely. Do you see this as something that you'll be marketing in what way? Magazines that are focused on this neurodiverse community?
Social media is a great platform. We've especially found that this community aggregates on Facebook.
All right, I've got to cut you off there. Thank you so much, Skapa. We look forward to seeing what you guys do in the future.
Thank you.
All right. All right, that was Skapa, another wonderful project. Folks, it's time for the giveaway to see if you correctly answered the question that I gave before the presentation. The giveaway is for bone conducting headphones. And the winners, singular, one winner for the bone conducting headphones is Jake Hunter. Congratulations on answering correctly the fastest. All right, folks, it's time for presentation number 3, which means quiz question number 3, to win a pocket projector. The quiz question is, what is in the Specktrum Air that kills airborne diseases? Once again, what is in the Specktrum Air that kills airborne diseases? Folks, give it up for presentation number 3, Specktrum Air.
Hello, we are Specktrum Air. I'm Daniel. This is Ryan, and we are really excited to share with you just a little bit of what we believe is an extensive solution to a substantial problem you're currently experiencing. I will say Claire is a key member of our team. She's not able to be here today. Mechanical engineering, I'm electrical, and Ryan is all about the business.
All right, so Specktrum Air seeks to solve the issue of unclean air. We have new technology and innovation that we believe will be monumental in this space. This is our first prototype, the design of it, the Specktrum Home Mini, and we're excited to tell you more about the technology behind this and what makes it so special and unique. So again, the problem is unclean air. This is something that's been especially poignant during the COVID-19 pandemic, but it's a pain point that we've been feeling for many years. In the United States and other developed nations, we've been able to enjoy clean food, clean water, clean surfaces for the most part, and unclean air, however, is part of our life that needs to go away. So these airborne diseases is something we're really addressing here, everything from allergies to tuberculosis to COVID. So speaking to the size of this problem, the magnitude of this is an $11 billion market currently as of 2020, and it's growing at a 45% global CAGR to $90 billion in the near future. So obviously this is a very huge need that people are trying to solve. Currently, the market mostly consists of things such as HEPA filters, but we believe we have something that can be much more innovative and penetrate more thoroughly through this market.
Now, the key question you should be asking yourself right now is why Specktrum? What are they going to do that's so much better than what's available right now? First, the industry is focused on filtration, not purification. Our biggest competitor are HEPA filters, which are expensive, clunky. They lose effectiveness over time, and they just collect pathogens, never eliminating them. In contrast, we annihilate those same pathogens that cause allergies, flus, COVID-19. Secondly, those companies that are attempting to use UVC mercury lamps are not hitting the correct dosage. We use UVC LEDs that are cutting-edge technology and allow us to have new applications like our air channel system, which is patent pending. It combines a revolutionary reflective paneling on the interior with tight circulation, which extends exposure time and increases the effectiveness exponentially.
So like Daniel mentioned, here you can see an image of the top of our prototype device. The air coil system is really what's revolutionary here, and it's patent pending. We've submitted a provisional patent for this. The tightness of the coil, the exposure of the UVC LEDs, the drawn out time that the air is exposed to these UVC LEDs actually allows us to achieve efficiency of 99.999% in cleaning a room in about an hour and a half, a large room.
So here you can see a prototype in action. One of the key compliments we get is that the system's practically silent, allowing use through all hours of the day and night.
Going on to microeconomics, our prototype cost us about $367. This was a little bit more expensive, frankly, because we were experimenting and we didn't know exactly what we were doing. But we were projecting that our final project will be about $108. So based on our customer surveys, we believe people are willing to pay upwards of $200, which leaves us with a gross margin percentage of a healthy 50% and above.
Now, we're excited about where we are, and we're excited about where we're going. We see this technology becoming essential in schools, in hospitals, in businesses and offices and factories. We see it integrated in masks, in cars, in planes, in cruise ships. We see it throughout America, throughout Asia, throughout Europe, and throughout the world. In short, Specktrum Air will be everywhere. Thank you. Questions?
All right, yes. Well done, Specktrum Air. Thank you so much. It's time for 4 minutes for question and answer with the judges.
I've got one that we can start with. Have you had anybody do an independent analysis of the effectiveness of your device? Because I'm guessing you're going to need a UL Labs kind of certification. Have you thought about that and made any progress in that direction?
We have not yet accomplished that task. It's on our list. We're in that prototyping stage and doing our own personal testing at this point, but that is on our next kind of step.
To add on to that, we have a computer model that helps us to monitor the effectiveness and efficiency of the device, and we've been using that model to kind of gauge where we're at and where we need to be. Currently, UVC LEDs, we mentioned, are cutting edge technology. They're quite expensive right now, but based on information we get from industry experts, this is a technology that's going to drop in price very rapidly and make it something that's much more marketable in the near future.
Hey guys, how do you handle ozonation? Don't you create ozone when you put UV oxygen through UV?
It's an absolutely great question. From the studies that we've done, it hasn't, this is coming from FDA and other research that we've looked at, it isn't a huge presentable issue. As we scale it, it will be something that we need to address in the future.
Thanks.
Building on Tom's question, what is the comparative performance relative to current state-of-the-art on air filters?
Competition. Yeah.
Significantly more effective? We're not, obviously it's not, the play isn't to sound something that's significantly less expensive. So performance will be the compelling purchase criteria, I imagine.
Yeah, thank you for the question. That's something that I can speak to a bit. So there's obviously a wide competitor field right now. In terms of UVC technology, what we're seeing online is, it's a very small number of companies who are actually experimenting with UVC. And what we're seeing online is unfortunately a lot of scamish type products, products that claim high efficiency rates, but what they're really just advertising is the fact that the technology has the potential to clean at those efficiency rates. And so it's very misleading. When in reality, you actually need that longer exposure time, the close proximity to UV LEDs, and some of the other technology that we have built into our prototype to actually be what others are advertising to be to consumers.
To what degree is air changeover important here? HEPA filters, you can get a lot of flow through a HEPA filter. In this case, you're saying an hour and a half for a regular sized room. What happens if you have 8 people in the room, 12 people in the room? What's your changeover time then to clean the air for that group?
It's a great question. So one of the things that we're really excited about our technology is that, like we said, it's practically silent. The idea is that you just kind of have it constantly running within your home. This is the initial prototype for a single room. The idea long term would to have these devices installed into HVAC systems and similar to what filtering is doing currently. And so that you're currently moving enough airflow through to keep the home safe and clean.
30 seconds remaining.
I'll ask a simple question. How do you clean it? Dust obviously is going to coat the lenses or the lights, and then the effectiveness drops off. How do you clean your system?
Yeah, so thank you for the question. I think that in this first prototype we did not have any sort of filtering or cleaning system, but a very basic filter is something that's easily implementable and something that we're looking into in future prototypes. The filter would not serve to actually filter out the air.
All right, thank you, Specktrum Air. We are out of time. I have to cut you off. Thank you so much.
Thank you.
Thank you.
All right, folks. It is time for our next giveaway for those who correctly answered the quiz question before Specktrum Air. The giveaway is for a pocket projector, and the winner of this pocket projector is Amy Allen Bowers. Congratulations, Amy. They'll be in touch to give you your prize. All right. Next, we have presentation number 4, which means another quiz question. This time to win a drone or a Khione hammock. The first person, I believe, will win a drone. Second, will get a Khione hammock. The quiz question is, how does FootCore Pro relieve foot pain? How does FootCore Pro relieve foot pain? Ladies and gentlemen, a warm welcome to our 4th group, FootCore Pro.
Several years ago, I went hiking in the mountains of Idaho to watch the full solar eclipse. It was an amazing experience that I will never forget. But what wasn't so amazing is that on the way down, my feet began to hurt me so bad that I couldn't even walk. Now, I've had bad foot pain my entire life, and I've had to wear custom orthotics, ugly shoes, and oftentimes limit my activity to keep my pain levels manageable. But this was a new low for me, and I felt like I was losing my lifestyle. I'm not the only one with these problems. 81% of Americans have significant foot pain every single year, and a quarter of Americans actually have flat feet. People spend $4.5 billion on orthotics alone, not to mention all the other doctor's appointments and treatments people use trying to find relief for their foot pain. I decided there had to be a better way. I found new research from Harvard University called intrinsic muscle strengthening. The basic idea is that you can figure out a way to activate and strengthen the muscles deep inside the arch of the foot that will allow the foot to regain its natural biomechanic posture so that your foot can function without pain. I found over 100 clinical trials showing that this is the best way to treat our current foot pain problems, including plantar fasciitis, flat feet, and even helping athletes balance and run better. The problem is, no one has found the technology to strengthen these key intrinsic muscles until now. This is the FootCore Max, the world's first intrinsic strengthening system for the foot. It works by isolating, activating, and strengthening exactly the right muscles in exactly the right way. It's kind of like doing a sit-up for the core of your body, but for the core of your foot. It raised $20,000 in crowdfunding, which was really exciting, but I knew that it could be even better. So I created the FootCore Pro. The FootCore Pro is based on feedback from the original Harvard research team, biomechanic experts, and medical practitioners from across the country. It incorporates electronic sensors so that users can measure how strong their feet are getting, resistance control so that old grandmas and a marathon runner can both get a great workout for their feet, as well as other features to make it simpler and easier to use. Validating these products has been amazing because 100% of testers have reported significant improvements in their foot health in a short amount of time. It's currently being tested in D1 to college athletic programs, as well as its integration into physical therapy offices by athletic trainers and even by podiatrists.
To strengthen your arch and actually raise the arch just with using a device rather than some expensive surgery and orthotics, then this could be huge. It could benefit so many people out there.
I'm not kidding. This thing has been a serious game changer.
Using the FootCore Max has absolutely changed my life. It's changed the way I walk, the way I run, the activities I'm able to do, and I actually feel like I can go out and just be myself.
Just every day, my knees bother me less, my back bothers me less.
I don't have to stop and shake my feet out because I'm trying to get rid of any pain. I'm able to just go and not even think about it.
As you can see, FootCore products changes people's lives dramatically, and it changed my life too. This is a picture of me just this past summer on the exact same hike where I had my breakdown, but this time I didn't feel a twinge of pain, and I didn't even need to wear the orthotics that I've been using since I was a little kid because of how strong and stable my feet have become. It is my dream to bring the power of intrinsic muscle strengthening to the hundreds of millions of people who suffered from significant foot pain. Thank you.
All right, thank you, FootCore Pro. Let's go ahead and put 4 minutes on the clock for question and answer from the judges.
Thanks, Spencer. Great presentation. Love the sit-up analogy, and neat to see the validation on Indiegogo. That's cool, and love the testimonials. Obviously, critical to your strategy here is distribution with the physical therapists, trainers, and the like. What's your strategy to build awareness and distribute the product? Med device companies, pharmaceutical companies, it's spent a lot of money to develop and nurture that channel. How are you planning to go about that?
Yeah, we're doing a couple different things. One, we're applying for major research government grants to get really powerful third-party validation of the product and its effectiveness. We're working through podiatry consultants and consulting firms to help them get in the hands of podiatrists. And we're working with influential physical therapists and other athletic trainers that are already starting to incorporate some of these theories into their practice, but this device will help them bring it to the next level and help their patients even more.
Sir, how big is the test pool? Sounds like there's quite a few people that have tried it.
The initial test pool was 25 people who self-reported their results.
You mentioned that this was going to have a feedback loop. Can you talk a little bit about, is this something through your cell phone or what is the feedback loop?
Yeah, I'd be happy to talk about that. The FootCore Pro has a LCD screen built into it so that the user can see how much force they're able to exert through their foot. Real-time feedback, if you will.
Is there a training plan that goes with it that suggests X kinds of exercises or duration of exercises for certain kinds of foot pain, or how do you manage that user experience?
Yeah, that's exactly right. We have a treatment kind of handbook to help users get the most out of it, other stretches and exercises they can do, as well as recommended training protocols to use the device in their home.
You talked about two products, the initial one and then this more advanced product. Are you talking about introducing both or has one become the successor to the other? And can you talk about price points?
Yeah, happy to. So the FootCore Max will retail for $79, so a lot cheaper than a pair of shoes or a custom orthotic. We were going to introduce both products, one kind of as a high-end device and one as kind of a lower-end device. With the goal being the high-end device could really reside well within medical practices as a diagnostic and treatment tool, and then the patients can get a cheap version to take home with them.
Your business model, is it to just sell your product? Do you have a service offering that goes with it? How are you thinking about monetizing it?
Right now we're going just straight product to customer. We're looking into service options in the future.
What would be the closest treatment corollary or substitute to your product today?
This is the first of anything of its kind on the market. There's foot exercise devices kicking around, but none of them isolate the right muscles inside of the foot to provide the proper biomechanic effect.
30 seconds remaining.
I'll add in this is utility patent pending as well.
All right.
Can you just describe what that patent is and what is the uniqueness of the patent?
Yeah, the uniqueness of the patent is a device that isolates specific named muscles within the foot and that activates and strengthens them in a variety of different ways. I can't list them all off to you, but we hacked it out with a lawyer and we got a bunch of different options in there, so it should be well covered.
All right, thank you so much, FootCore Pro. Well done and good luck. All right, wonderful. It's time for our next giveaway, folks. We are giving away a drone. The drone, for the person who correctly answered the quickest to the question regarding FootCore Pro, goes to Tyler Crisp. Well done, Tyler. Enjoy your new drone. After that, we have, it looks like 3 hammocks to give away for our next 3 winners for answering the FootCore Pro question. We want to give a quick thank you to Khione Outdoor Gear and the co-founders Casey Messick and Ben Gong. After winning SIOY in 2017 with their hammock tent product called The Shell, Khione led successful Kickstarter to raise $90,000. This summer, they launch a second campaign for their new line of products. And so that is the founder for the Khione hammock, which we are now giving away. And the winners for the Khione hammock are Connor Lindsay, Batsagan Illik, pardon my pronunciation, and Annie Burgoyne. Congratulations to Connor, Batsagan, and Annie, and enjoy your new hammocks. Folks, it's time for quiz question number 5 to win a GoPro. All right, the quiz question is, how many pin joints are used in the LaparoVision wiping mechanism? Once again, how many pin joints are used in the LaparoVision wiping mechanism? Folks, up next, LaparoVision.
A year ago, our team shadowed a routine laparoscopic procedure. This is where surgeons insert multiple instruments inside the abdomen of a patient, including a small camera called a laparoscope. We watched the scope's monitor feed as the surgeon made a careful incision. Immediately, a jet of blood squirted onto the lens, obstructing the vision. The surgeon tried to clean the lens on a nearby organ, but it just made it worse. So we anxiously waited as the technician came to remove and manually clean the scope, leaving the patient helpless on the operating table. Once clean, the surgeon reinserted the scope and navigated back to the surgical site, but this process had already taken 4 long minutes. And this wasn't a one-time occurrence. In that same 1-hour procedure, the scope was removed 5 more times for cleaning. In fact, about 20% of a laparoscopic procedure is spent cleaning the scope. This wastes time, patient risk, and costs way more than necessary. In the US alone, $4.8 million procedures are performed annually. With operating rooms averaging $62 a minute, the wasted time adds up, costing hospitals $1.6 billion each year just to clean the scope. Many have posed solutions, but none have succeeded due to small scale infeasibility and high manufacturing costs. Our approach is completely different. We've spent the past 2 years iterating and innovating until we found a solution that could meet the complex constraints while being inexpensive and minimalistic.
So the breakthrough of our technology is not just the apparent idea of attaching a mini windshield wiper to the end of the scope, rather how we were the first to actually successfully succeed in making this device. So what you're seeing on the screen is actually an at-scale, fully functional 10mm prototype. So the first challenge we had was trying to conform to the scope. Our mechanism does not extend past the outer edge of the trocar, therefore not interrupting with the trocar as it enters the patient's body. It also doesn't cover the front of it, therefore not obstructing the field of view. So our entire mechanism, when not in use, is fully concealed along the outer perimeter of the laparoscope. We did this by converting traditional kinematics into a novel developable mechanism. The second challenge was reducing the number of parts to make it scalable and affordable to manufacture. We completely eliminated all individual joints and links by folding precisely a single piece of metal to an origami spring-like structure. If we were to recreate this with familiar engineering principles, it would require 23 parts. So this has not gone unnoticed. We just placed first place in the International Mechanism and Robot Design Competition. And surgeons across the country love it, telling us that they've been wanting it for the past 20 years. And lastly, hospital administrators agree that we will have a significant impact on reducing operating costs.
Having personally been through a laparoscopic procedure, I know how terrifying it is to be warned of potential complications and then experience them. That's why our team is focused on reducing these complications so that surgeons can better focus on saving millions of patients like me.
Thank you. And if possible, could you play the video that didn't work? Basically, the video was a great way to show how it functioned and actually worked.
LaparoVision.
So,
Our novel patented solution is a single-use disposable attachment,
Thank you, LaparoVision.
which connects to a standard
It is time for question and answer from judges. 4 minutes on the clock.
Okay.
See the video if we could.
That would be helpful.
inside the abdomen without hindering their workflow. It is unlike anything seen before. We address each component of the problem by reducing wasted time during procedures as well as improving patient outcomes.
This origami-based design has allowed us to scale down and make the most critical component economical to manufacture, succeeding where others have failed. Ensuring efficacy and reducing risk for the patient has been critical during the development process. Our design has been refined through hundreds of iterations. The design has undergone testing and analysis to optimize fatigue strength, life cycles, and pressure and pitch angles, making it safe, reliable, and effective.
LaparoVision. Simple, economical, intuitive.
Could you step a little bit further inside?
So how many surgeons have tested it?
Yeah, it's a great question. So we actually haven't gotten FDA approval yet, so therefore we can't actually do human testing. But we've been working with surgeons. We've gotten a ton of feedback from surgeons across the country and working closely with surgeons closely here to do kind of more ergonomic testing of the device.
It looks like a very elegant solution. Congrats on the progress so far. What was the source of the idea?
Sorry, say it again.
Why did you focus on this problem in particular?
Yeah, so it actually turned out we were trying to validate a completely different technology, and we were going around to different operating rooms, shadowing different surgeries, and we actually, as we're trying to validate this other technology, this problem kept coming up again and again. And surgeons kept saying, this is awesome, but there's also this cleaning problem. And so it just kind of kept realizing this was a much more critical problem to develop, and we actually pivoted from our other device and focused on this.
That's great.
I'm just curious, in the operating room, surgeons are known to be very picky. Is this going to inhibit ergonomically how they do the surgery? And then I see the knob, kind of a star-shaped knob that the surgeon, I guess, manipulates to make the windshield wipers work. Who's going to teach them to use this knob and keep it out of their way when they're doing the surgery?
Yeah, that's a great question. The design we're currently working on takes that knob and turns it a little more vertical, which is very similar to what surgeons currently use to zoom in and out with the scope. So it's very similar to what they're already using, what they already know, so it shouldn't have much of a learning curve. Obviously, it will come with some simple instructions, but...
And that's one of the great benefits of this is it's extremely intuitive because, as you said, surgeons don't want to interfere with their current workflow. And so our device adds no extra space, no extra impact to the actual current workflow. And so therefore they can actually just easily use that in the operation without even thinking about it.
Is the diameter bigger? Does it make the scope of the diameter of the scope bigger?
Yeah, so usually you go with the 10 millimeter laparoscope, you usually use a 10 millimeter trocar. So with our device, you actually have to use a 12 millimeter trocar, which isn't really a concern for most surgeons.
What testing? Go ahead, Ryan.
It works with any scope OEM?
Sorry, can
you said did it work with any scope? Yeah, so we've made it compatible with angled scopes, and basically across the industry, the lead medical device providers for these laparoscopes kind of follow a very similar design, and so it'll be very compatible with all the top laparoscopes on the market.
Just two quick questions. Added cost for the laparoscope, and then secondly, have you done any testing in cadavers or with animals to give you a sense that it will really work in real-world conditions in the body?
Yeah, so we haven't done real-life testing in any animals or humans yet or cadavers, but we have been able to simulate the same environment in our own lab and try to replicate those same settings. And to answer your question about added costs, so actually it's a recurring revenue model, if you can see on this slide, which basically shows that
10 seconds.
We'll be selling for well under $100 and have great profit margins, and so it doesn't add actually to the laparoscope cost, but adds to the procedure cost for the hospital.
All right, thank you so much for laparoscope. Good luck, both of you.
Thank you.
Thank you.
All right. Up next, we are doing our giveaway for the GoPro for answering the question correctly for laparoscope. The winner of the GoPro is Jared Hunter. Congratulations, Jared. It's time for presentation number 6, which means it's time for quiz question number 6, giving away a MyoStorm Meteor, a heated massage ball. The question is, the battery on the Orion Belt can last up to how many hours? Once again, the battery on the Orion Belt can last up to how many hours? Folks, give it up for our next contestant, Orion Belt.
Hi, my name is Spencer.
And I'm Jake.
And we're the inventors of the Orion Belt.
We love to run, especially at night, but that can be dangerous. In the US, a pedestrian dies in a traffic-related incident nearly every 88 minutes, and that usually occurs at night.
These statistics represent runners, walkers, and bikers, all of whom struggle to see or be seen while they're out.
These aren't the only people with this problem either, but professionals as well. These men and women need something to protect their lives while they're protecting ours.
Lots of products exist that help you to see, like a headlamp, or be seen, like a reflective vest, but none that effectively does both. So if 70% of Americans run, walk, or bike, and the global reflective safety gear market will grow to $31 billion by 2025, why is there no effective solution so you can see and be seen?
We found that people have a list of general features that they're looking for, but they couldn't find one single product that did it all. And that's how the Orion Belt was born. We engineered a patent-pending 360-degree LED band, which emits a 12-foot field of light all around you. That not only helps you to see where you're going, but it helps you to be seen as well.
We created this product to work with any activity. We engineered a waterproof design and reduced initial weight by half, making it not only more durable, but hardly noticeable to the user as worn over the clothing.
And rather than using a traditional belt buckle, we designed a custom magnetic closure feature, which enables us to use a one-size-fits-all model. And in working with manufacturers and one of the top battery designers in the world, we were able to quadruple our battery size to exceed 6 hours of usage time using a uniquely incorporated battery structure.
Between customizable lighting patterns and our one-size-fits-all design, we're ready to enter the market, selling one product that meets the needs of everyone, ranging from a hiker or a runner on a dark trail to a construction worker that needs the use of both their hands on a dark site.
Our early validation efforts have already come back with more than 300 respondents and a lot of positive feedback. People are excited about our product.
88% of respondents said that they would use this product and 78% said they would purchase.
We're currently working with local and international manufacturers to refine our final production model, and we'll be ready to go to the market very soon. Together, our engineering has shed a new light on your safety.
So you can see and be seen. This is the Orion Belt.
All right, well done, Orion Belt. Thank you. It's time for questions from the judges. Let's put 4 minutes on the clock.
Can you walk us through the economics? What do you think it's going to cost to manufacture? What do you think you can sell it for?
We're currently looking at a range between $60 and $100, which depends on our final manufacturing costs that we're currently working on with the manufacturers, like Jake said.
There are some competing products on the market. I noticed one called Lumigear Halo, which you wear on your head, and another one called 180 Belt Light, which is, I guess, half as good as yours because it's only 180. Can you talk about how you think you match up to the competition?
Absolutely, great question.
Definitely. That's a great question. Talking about headlamps and working with some marathon runners and some more professional capacities, we realized that the headlamp actually had a bobbing effect that a lot of people didn't like. It inhibited their night vision a little bit, and it just became burdensome and heavy. These other belts, like you already noticed, they don't go the full 360 degrees, so that only helps you to see, but from coming up behind you, cars and other things can't see that you're ahead of them.
It seems like, I don't know, it might be fairly easy to circumvent whatever intellectual property barriers you put in place for existing workout equipment providers to add some LEDs around the straps of their headlamps. Do you expect that to happen, and you're planning to differentiate the product in some unique way?
Yeah, that goes back to one of the original reasons that we created this product, because it just works. We don't want to have customers that have a headlamp that they add reflective gear to, that they then add another headlamp to, like people are currently doing. So our unique benefit here is that it's one single product that allows you to see and be seen. And it charges simply and it works easily. So it's not something that you would need to add other things to make it work better like you would with some other products.
A main issue a lot of competitors are experiencing is they have a bulky battery that either sits to the side or it's burdensome to whoever is using it. So we've worked really hard to make a small enough battery that gives you that lifespan, but it's not getting in your way, and they think that that's a real good edge on the market.
Can you talk about the geek factor on this? I mean, I like, to look a certain way when I'm doing things, and, running around with the belt, I don't know, I think I feel awkward. Do you think that's a barrier you have to overcome?
Yeah, and that's an awesome question. The main reason I actually ran at night is because I felt the same way you do, just about myself in general. This belt, we're actually incorporating buttons and an application into the design of it, so we can make it as noticeable and bright as you would like it to be. We can tone down that dimness, we can direction the lights to make it more usable for what you need, but not more than what you want.
Can you give us some idea how much it weighs?
It weighs 12 ounces.
Less than a pound.
Correct.
How long will the lights last?
6 hours.
6 hours. And you think you're pricing between $60 and $100, or is that your cost to manufacture?
That's our pricing, correct.
And what do you think your cost is going to be?
30 seconds.
We're going to operate with a 70% profit margin.
All right, do we have any other questions for Orion Belt? All right, thank you so much for joining us. Good luck to the both of you.
Thank you.
Thank you.
Folks, it's time to give away a MyoStorm Meteor. A little background about the MyoStorm Meteor. The founders were former SIOY competitors in 2018. They appeared on ABC's Shark Tank, and all the sharks wanted their heated massage therapy ball. I want to give a big thanks to the MyoStorm founders for donating this prize. And the winner of the MyoStorm Meteor heated massage ball is Daniel Everson. Congratulations, Daniel. Enjoy your MyoStorm. All right, folks, it is time for the final quiz question for our final team. The question, which if you get it right, you'll win an Apple Watch. The question is, true or false? You must have a vertical metal surface to use MagTrax. Once again, the question is, true or false? You must have a vertical metal surface to use MagTrax. Folks, our final contestant, MagTrax.
All right, hey everyone. If you're like me, it doesn't take very long scrolling through your social media feed to realize that lots of people struggle to find ways to entertain their kids, or themselves for that matter, without using a screen. And that's true whether we're in a pandemic or not. Now, I love a good movie or screen binge as much as anyone, but the problem is too much screen time can be really harmful. So when parents need to occupy their kids, other options include gagging and binding them, as shown in another social media post here, or resorting to a screen-free option like Legos, building blocks, magformers, etc. They'll build creativity, but the problem with these is that they make a mess. So we really need an option that entertains our kids without creating a disaster in our house. That is where MagTrax comes in. So MagTrax is a mess-free, modular, and mesmerizing magnetic marble track system that was designed to destroy boredom and boost creativity and problem solving in a way that doesn't create clutter or take up any floor space. With 26 different types of track pieces to choose from, the creativity and possibilities are endless. So in understanding the innovation, engineering, and impact of MagTrax, you'll see why it is the ultimate solution to helping reduce both screen time and toy messes. The first thing that makes MagTrax unique is the 26 different types of tracks that can be used to build your marble run, including loop-de-loops, funnels, corkscrews, snakes, and even a piece that will turn off your light. But it's been a huge process to refine the tracks into how they look today. Here's a look at how the designs of a few of the tracks have evolved from the original clunky prototypes on the left to optimized production-level tracks on the right. All of these different tracks combine to make the design possibilities of clutter-free track building literally limitless. Since they're magnetic, they can be built on just about any ferromagnetic surface like metal doors, fridges, or metal sheets, as shown in these pictures shared with us by some of our customers. But with MagTrax, you aren't limited to just metal walls. They can also be built on any wall in your house, magnetic or not, using the mini metal plates and reusable wall putty that come with the MagTrax kits. Although the design might seem intuitive, which is the hallmark of a good design, the design of MagTrax has gone through an extremely rigorous process that has resulted in a 55-page professionally written provisional patent that we filed last August. Each piece has not only been optimized for manufacturability, but rigorously tested to make sure it can be manufactured at scale. In terms of validating their quality, our customers have spoken for us and given us an average 4.96 out of 5 rating over 56 verified product reviews. One of my favorites was written by Christiane B., who struggled to pull her 14-year-old away from video games until she found MagTrax. And for me, it doesn't get more rewarding than that. So let's see, in terms of impact, we're looking at a huge total available market of $6 billion. Obviously, it's pretty unlikely that we'll capture that entire market, but you can see that the potential for MagTrax is huge. As an added plus, MagTrax are manufactured and assembled in the USA to positively impact our local economy. Even the plastic used to make MagTrax was made in the USA. So where are we at with MagTrax? Well, I'm excited to announce that it's available right now at magtrax.co. And for our awesome SIOY crowd, and just to do something fun, we're offering an exclusive 10% discount on all kits if you order by midnight tonight, and you can join the thousands of others that already own and enjoy MagTrax. We are MagTrax, and we make mess-free, modular, and mesmerizing magnetic marble tracks that you can build anywhere. Thanks.
All right, thank you, MagTrax. Well done. It's time for question and answers from our judges.
All right.
Love the pitch to us right here now. I think that's clever.
Got to get free advertising however you can, right?
Good initiative. Love it. Where did the customers come from? Have you been selling it on your website to this point? Is that where you've collected the reviews? Did you do separate user testing prior to making it available generally to the public?
Yeah. So we launched a Kickstarter last August 24th. And then after the Kickstarter was over, we went to direct pre-orders through our website. And now we're selling through e-com, primarily through the website, and just starting some outreach through an educational initiative where we offer a discount to schools who then offer a discount to their students, and we kick back a % of the revenue to the schools as well. But yeah, in terms of reviews, that's all been through the Shopify app. Judge Me that we've used to collect those.
How many did you say you've sold so far?
So we have thousands of users and people that have used with it so far.
If you do a search online, you can find a variety of marble mazes. Like Space Rail might be one. There was another one I found, Zyloba. They exist. However, they're floor-based.
Right.
Do you feel your innovation is getting it up on the wall and getting the kids crawling the wall?
Yeah, that's the biggest thing, and that's what kind of inspired me in the first place,
was having a son that likes blocks and likes these STEM type building things, but they just create a disaster. And the main benefit is, yeah, moving it to the wall. So you have that creativity and problem solving, but it's not taking up floor space. And in our reviews, I'd say that's probably the biggest benefit that people mention.
What kind of plastic are you using with it?
PLA.
Okay. Is it injection molded, the whole thing?
Nope. So we are mass producing these using industrial 3D printing, actually.
And are you getting the durability you need out of PLA?
Yeah. Yep.
So far?
Mm-hmm.
Okay.
Yeah, there have been a few that were broken in shipping with UPS getting a little carried away, but we beefed up our packaging and that hasn't been an issue since then. So.
And what kind of margin are you earning on it right now?
So net profit out the door is around 20% with everything included.
Okay.
Do you see an opportunity as volumes grow to hard tool it and injection molding?
That's the question I get asked all the time. And the answer to that is no. We actually don't plan on that because we're getting decent margins with the industrial 3D printing. And with being able to do that, we can embed the magnets inside. So if you swallow a magnet, you can die, basically. So that's a big thing. Design capabilities, as you know, the way that 3D printing works. You can get designs that are literally impossible injection molding because of the way the undercuts work and things like that. Speed to market and speed of developing new tracks is another benefit of 3D printing at an industrial scale, and then optimization of workflow and manufacturing is another benefit.
Awesome. That is our time for MagTrax. Thank you so much and good luck.
Thanks.
All right, folks, it is time to excuse our judges to deliberate. When they come back, we will announce the 2021 Student Innovator of the Year. In the meantime, we do have our giveaway for the Apple Watch, and the winner of the Apple Watch is Jenny Beth Stenquist. Congratulations, Jenny. Enjoy your watch. All right, folks, it is time for you to vote for your favorite to win $2,000 for your favorite contestant. That's right. Whoever you get the most votes for will get an additional 2,000 votes in addition to their prize money. So, in order to submit your vote, send a text message to 201-855-3028. Once again, that's 201-855. Oh, excuse me. I have just gotten an updated phone number. I'm sorry. It is 385-257-9288. Ignore the last number I just said. The correct number to text is 385-257-9288. And all you have to do is text the number, a single number, in order to vote for your team. So don't text any other words or punctuation or anything like that, or else it will not be counted. Simply text 1 for Geneial, 2 for Skapa, 3 for Specktrum Air, 4 for the FootCore Pro, 5 for LaparoVision, 6 for the Orion Belt, or 7 for MagTrax. Only 1 vote per device will be counted. You have 3 minutes, so get your votes started now. Two minutes remaining to vote for your finals favorite, who will win $2,000 in addition to any other prize money. Just 30 seconds remaining. Your vote will determine which team will win an additional $2,000 of prize money for their project. Five, four, three, two, one. Time is up. Folks, thank you so much for tuning in. Real quick, we want to give a big thank you to our Student Innovator of the Year sponsors. We could not do it without you. First up, David and Rachel Weidman and BYU Engineering's Weidman Center for Global Leadership. We also have BYU Ira A. Fulton College of Engineering and the BYU Rollins Center for Entrepreneurship and Technology. Thank you. We also want to thank our Dean of College, Michael Jensen, and our Center Director, Chris Crittenden. Thank you so much for your sponsorship. We would also like to acknowledge our staff, our directors, our student committee, our SIOY staff, our judges, of course, and our mentors. Thank you so much, all of you, for coming together to help make this wonderful competition come to life. If you're a BYU student or you want to team up with a BYU student, you can compete in next year's SIOY by visiting sioy.byu.edu. Once again, that's sioy.byu.edu. Sign up for the email list for information and the competition application. Folks, while our judges are deliberating, we want to introduce a special guest. For our audience to understand just how far Student Innovator of the Year competitors can go, we have a special guest. BYU chemical engineering student who went from a student entrepreneur to CEO of a billion-dollar company in just a few years. And they just announced a merger that will land them on the New York Stock Exchange. We would like to welcome Kurt Workman, founder and CEO of Owlet Baby Care.
Thank you so much for having me. I hope everybody can hear me. I'm just grateful to be able to be associated with BYU and SIOY. I think there's such an amazing spirit, and the opportunity to bring God into our lives, even at school, is incredible. The motto of BYU, which is enter to learn and go forth to serve, is really the perfect model for entrepreneurship. When you think about lean startup methodology, it's all about learning from and serving your customers to solve their needs. And I really just think that's the key to success in creating value. So I want to quickly talk about my story, the role SIOY played in Owlet, and where the company's at today. You probably guessed this, I'm a dad. I have 3 beautiful children, and my wife and I were especially concerned that our kids might have a congenital heart defect that runs in her family. She's had 3 heart surgeries. And when she was born, they didn't detect it. They thought everything was normal. And so there's this miraculous story of her mom finding her not breathing and rushing her to the hospital to do emergency heart surgery that saved her life. And I remember thinking, like, how would I know if something was wrong? How could I be there in the moments when my kids need me the most? And what I found was that every parent worries about their baby's health and safety, and every parent goes in to check on them at night. There's 40 times as many children that pass away unexpectedly in the crib than pass away from car accidents. It's called SUIDS, or sudden unexplained infant death syndrome. And it's made up of SIDS, which is probably what a lot of people have heard of, an accidental suffocation in the crib. So these babies are passing away unexpectedly at home almost 100% of the time during sleep. And when the parents are just mostly unaware and not checking. And so we learned about this technology they use in the hospital called pulse oximetry. It's that little red light that they put on your finger. And just thought, wow, this could give real peace of mind to parents, could keep them in the loop and notify them when they might need to check on baby. And that could make all the difference. So we got the $400 from SIOY to get started. We were also part of the Crocker Fellows program at BYU. We made our first prototypes. I remember going to the BYU sewing lab and awkwardly standing there and announcing that I needed to help making a sock. And it was just so awkward that I think finally somebody said, okay, I'll help you out. And they made me this little neoprene sock. And then we went to Radio Shack and bought a little LED light and a battery. And then I got connected to a videography student on campus who made a little video for us for $100. We sent a survey out to parents, and 96% of those parents said that they would buy the product. That got us really excited. Then a member of our team met with a professor who had done some work with pulse oximetry. We made a little breadboard to kind of prove out the technology. We entered that into SIOY, and just really just simply described the problem, the solution, and the market opportunity. And I remember feeling like we had so much money after we won SIOY. I think we won like $6,000 from the competition. And we spent all that money developing more prototypes to move the project forward. Today, most importantly, we've had thousands of stories from parents, many of them claiming that Owlet has helped save their baby's life. We have over 150 employees. 1.5 million parents have used Owlet. We've tracked over 4 trillion heartbeats, and we have the largest data set of infant health ever collected. We have 4 products in the market, and we're launching our 5th and 6th this year. We've won every industry and parenting award in our category, and we ship to 5 countries today. We're on track to do over 130 million in revenue this year, and we just announced a deal to take Owlet public for over $1 billion. I think it's important to note that Owlet is not alone as a success story from BYU. There are so many success stories out of the SIOY program and the Rollins Center for Entrepreneurship. It's just incredible. I love this quote by Steve Jobs. He says, "Life can be so much broader once you discover one simple fact, and that is that everything around you that you call life was made up by people who were no smarter than you. And you can change it. You can influence it. You can build your own things that other people can use." I think it's just incredible. When we first got started, I paid an industrial design intern $50 to generate a bunch of design concepts for Owlet. Later, after we'd raised $2 million in our seed round, we thought that we may be missing something because we didn't know any better. So we paid a Bay Area design firm $50,000 to generate a bunch of design concepts for Owlet. And when I compared the two, there was no unique concepts from the $50,000 that I spent that the student that I paid $50 at BYU didn't get me. So there's so much talent. There's so much that you can do if you believe that you can do it. And it's just incredible what's being created at BYU. I'm so excited about the amazing candidates we have this year and the service that they'll render to the world. I think I heard reducing surgical error, improving foot problems and pain, removing harmful pathogens in the air that we breathe, empowering parents with children who have autism, empowering play and creativity, connecting biobanks to relieve human suffering, keeping people safer as they're out at night. I mean, wow. Like when you think about the impact and the service that these innovations will provide to the world, it's just incredible. And I have no doubt that they'll have incredible potential, and everybody who's participated in the competition. So thank you so much for letting me be here. It's just incredible to see how far the competition's come and all the great ideas. Thank you.
All right, thank you so much, Kurt Workman and Owlet Baby Care. Folks, the judges have made their decisions, the audience has voted, and it's time to announce the winners. We want to give a huge thank you to all 4 of our judges for lending their time and their immense expertise to this project. We couldn't have done it without you. We so appreciate you for donating to this cause and helping these student innovators with the future, with these amazing things that they want to help change the world with. So first, let's go ahead and invite Dean Michael Jensen to help me award the winners. Dean Jensen, how you doing?
I'm doing great. How are you? You've done a great job today.
Thank you so much. I'm happy to be here. We're so happy to have you.
Well, I'm glad to be here. The teams have done a great job, and I can't wait to see. I think it's anybody's game at this point.
Honestly, we've seen so many amazing projects, so many wonderful ideas to help change the world. I don't envy the judges' position of trying to pick who the winners were, because I loved all of them. They had so many cool ideas in so many different areas, and we're about to find out who won.
Can't wait.
All right, folks. First, we are going to find out who was your favorite. Who is going to win the additional $2,000 by winning the Finals Favorite Award? Now, I don't know if we have a view. They are waiting to find out who won. There they are. They're so excited. They don't know who won yet, and I'm going to announce it now. The winner of the $2,000 Finals Favorite Award is LaparoVision. Come on in, guys. Collect your prize. Here they come. Whew, feels good. Here they come, here they come. LaparoVision with the window cleaner for the laparoscopic surgery. Here they come, guys. Come on in. go ahead and collect your oversized check and get a picture. Here you go. All right. Smile for the camera. I don't know where the camera is. All right. Thank you so much, LaparoVision, and enjoy your prize money.
Congratulations.
Oh, do we need one more picture? Oh, come back in, guys. Here we go.
Yeah, take off.
The first one was just a rehearsal.
Exactly.
All right, well done, both of you. All right, up next, third place to win a total of $8,000. This was the third place winner out of 7. All right, we got the oversized check here. Just trying to build up tension. All right, the winner is, for third place, total of $8,000, Skapa. All right, here they come. Once again, helping design a reward system for parents to give for their children so that way they can help be more organized, more motivated, help get things done, help with focus in general. Wonderful product. Hello, Skapa. Welcome, welcome. Come collect your prize, total of $8,000.
Let's grab that.
Right there. All right, congratulations to all of you. Well done.
Congratulations. Well done.
Ooh, we're getting close to finding out who the grand prize winner is. The runner-up for a total of $10,000. Folks, that is second place. They were among 50 contestants, 60 judges. They have come this far. Who is it going to be? All right, there they are, our final contestants. The runner-up winner is MagTrax for a total of $10,000. Come on in, MagTrax. Once again, MagTrax has the magnetic toys that you can hang up on your wall so that you don't make a mess and so you can stop looking at your screen. A wonderful design. Here we are, MagTrax. Well done.
Thanks.
How are you feeling?
Awesome. That was not expected. There are a lot of good teams.
I know, tough competition, and you got second place. All right, great job.
Well done.
Whew, Dean.
Okay, I'm excited to find out.
Here it is, the 2021 Student Innovator of the Year winner. The grand prize winner for a total of $12,000. Let me grab the trophy. They are going to win this prestigious award and a total of $12,000. Are you guys ready? Here we go, folks. The winner of the 2021 Student Innovator of the Year is LaparoVision. Come on in. Here they come, innovating for abdominal surgery to help surgeons improve their workflow, to help save time, help save our hospitals money, and just improve the safety and efficiency of surgery everywhere. Thank you guys so much. Congratulations, you did it.
Thank you so much.
Well done. All right.
There you go, you get another one.
One of you will take the huge check, one of you will take the huge trophy. All right, let's get one more picture. I should have you hold this. My apologies.
Exactly.
All right.
Thank you.
All right, great job, both of
Congratulations, you
you.
guys.
Thank you
Well
so
done.
much for competing. We're so glad to have you. We're so excited to see what you guys do in the future. And
I'm so sorry.
oh no, you're good. You're good. That's all. That's you're the winners. You did it.
Congratulations.
And thank you once again.
Thank you.
Dean Jensen.
Well done, thank you.
All right, folks. It is time to come to a close. We are at the conclusion of the 2021 SIOY. Folks, thank you so much for tuning in. Thank you again to our sponsors, our judges, our finalists. Well done, all of you. We hope to see what you can come up and how far you can go. And we're excited to see our next generation of student innovators. Folks, this has been the SIOY Competition 2021. I've been Joe Holt. Good night.